Hi, my name is Quinn Johnsson, and my proposed qualitative study will examine concussed athletes' readiness to return to sport following concussion rehabilitation and the psychosocial factors of rehabilitation. I'd like to thank Dr. Karen, Dr. Gonzalez, and Dr. Rathwell for helping me design this study. A concussion is a type of mild traumatic brain injury that is not associated with structural changes to the brain, but rather physiological changes. This can result in a wide variety of symptoms, including emotional, such as difficulties regulating emotions, cognitive, such as difficulties thinking, and somatic, such as headaches or sensitivity to light. Part of the reason why I'm interested in concussions is because more than half of them are related to sport. Additionally, they can be difficult to assess and treat. One reason why concussions are difficult to assess is because they're not typically related to common signs of injury, such as bruising, bleeding, and fractures. We are actually so limited in our ability to treat concussions that most approaches only involve symptom management. It was actually for this purpose that the return to play protocol was created. The Return to Play protocol is a 6-step guideline designed to reintroduce athletes to physical activity, which becomes gradually more intense and sport-specific until athletes are able to return to play. Now, athletes may enter this protocol once symptoms have subsided, beginning with daily activities such as work or school. While this protocol is useful for managing the somatic symptoms of concussion, it is unable to determine whether athletes who complete this protocol are psychologically ready to return to sport. Now, what does it mean to be psychologically ready? Well, a variety of factors that may be related to this construct have been measured. This includes confidence, emotions such as anxiety and fear of re-injury, risk appraisal, realistic expectations of recovery, motivation, and social support. Something I want to emphasize is that we currently do not have an operational definition of what it means to be psychologically ready. Additionally, these studies looked at athletes with musculoskeletal injuries and didn't consider athletes with concussions. Considering this, I'm curious as to whether athletes feel psychologically ready to return to sport following concussion rehabilitation, and what role psychosocial factors play during rehabilitation, if any. Since this is a qualitative study, I'm going to begin by defining my philosophical assumptions. For my epistemology, I'll be using social constructivism, and this is the idea that knowledge is constructed in the mind and is preceded by social interactions. For ontology, I'll be using ontological relativism, and this is where the reality of experience is considered to be relative to the individual. Now, I'll be using a multiple case study design because case studies are useful for gaining an in-depth understanding in new areas of research, but only if you're able to make clearly identifiable cases. The cases for my study will be Canadian university athletes, half male and half female, and they must have experienced a concussion during the 2019-2020 season, participated in the return to play protocol, and were cleared to return to sport by a practicing physician. Data collection will be conducted with two methods, timelining, which I'll explain further, and remote semi-structured interviews, which will be one-to-one. To begin data collection, I'll actually have an initial meeting with each participant, and this will be where I teach them about timelining. So a timeline is a visual representation of events and experiences that are placed in a chronological order. Now, in this case, athletes will be asked to create a timeline of their rehabilitation, beginning with their concussion and ending when they were cleared to return to play. Now, while the horizontal axis of this timeline will be used to record time, I will ask athletes to add a vertical axis with which they can use to record readiness. This means that whenever an athlete adds an event or an experience to the timeline, they will consider not only when it happened, but also how ready they were to return to sport at that given time. This will provide further understanding of the athlete's progression during their rehabilitation and opportunity for questions around why they didn't feel ready to return to sport at a given time. Additionally, athletes will be asked to add experiences to their timeline that may have played a role in their rehabilitation, such as psychological factors, social factors, and potentially other factors that I may not have considered. Following the initial meeting, athletes will be asked to engage in their timeline both between and during interviews. The idea here is that the more opportunities an athlete has to engage with their timeline, the more likely this timeline will represent those experiences and events that are most important to the athlete and their rehabilitation. Now, 1 to 2 weeks after the initial meeting, there will be the first interview where we will talk about their rehabilitation experience. Here, I'm going to ask questions about challenges they may have experienced, social factors such as their support during rehabilitation, as well as psychological factors such as emotions that may have played a role in their rehabilitation experience. Following the first interview, 1 to 2 weeks after, will be the second interview where we will talk about their actual return to sport. Here, I'll talk to athletes about their experiences when they return to competitive play and whether they believe they were psychologically ready to return to sport at the time and why that may not have been the case. For data analysis, I'll be using inductive reflexive thematic analysis. Now, thematic analysis is where you identify patterns in the data, you create interpretations of those patterns, and you create descriptions from those interpretations, which are referred to as themes. An inductive approach means that you're building the themes the ground up from the data, and a reflexive approach means that during data collection, as well as analysis, I will be actively trying to understand my position as a researcher in the study and how that may affect the way I collect data as well as analyze it. Since this is a multiple case study, there will be 2 stages to analysis. First will be the within case, and this will be where I analyze the data for each participant individually and create themes for the individual. The second part will be a cross-case analysis, and this is where I analyze the data from all the participants to identify patterns between the cases. Now, for qualitative rigor, I'll be taking a few approaches. First, I'll make sure that timelines are participant-led so that they represent the events and experiences most important to the athlete's rehabilitation. I'll be keeping a reflexivity journal to maintain reflexivity throughout the process of data collection and analysis. I'll keep a paper trail to keep track of all the decisions I make, particularly during the analysis. As well, member reflection will help me understand at the end how representative participants feel these themes are of their experiences. Now, potential contributions for this study may be helping to define psychological readiness for concussed athletes, identifying the psychosocial factors of rehabilitation, as well as hopefully improving return to play for athletes. Thank you very much.